My name is Sarah Nash. I'm 18 years old, and I'm from Eastern North Carolina. Everybody on my dad's side of the family has back issues.
Sarah is unusually young to suffer from lower back pain. This led many around her to doubt the severity of her issues.
Whenever I would get off work, I just had to go lay down. It's hard being like that, being so young, because everybody else they think I'm just getting out of work. My back hurts, I can't do that. I'd say as little about it as I could, but at the same time, I couldn't do anything after work. Like I couldn't vacuum my house, and I couldn't mop my floor or do my laundry. I mean, it was kind of, that was it for the day. Where we live, the doctors and everything, I'm not sure if they really looked at my MRI, because it took me a year and a half. I've been dealing with it, and it's gotten worse every day. I've done the physical therapy, the injections, I've gone to rheumatology. I just felt like they were just sending me different places, juggling me so somebody else could deal with me.
After trying conservative treatments with no relief and getting the runaround from doctors in her hometown, Sarah started to consider having surgery at the Bonati Spine Institute.
I first came here to the Bonati Institute when I think I was a freshman in high school, because my grandma had surgery and I really liked the area in Hudson. There's a few places that I really love going when I'm here.
Upon arriving at the Bonati Spine Institute, Sarah was provided a physical exam and sent for updated MRIs at the on-campus imaging center. A short while later, she met with the surgeon to review her images and discuss a customized surgical plan to eliminate her lower back pain.
It's really convenient, because if they decide they want you to get an MRI, you just walk over there and get an MRI. After a year and a half at home, trying to figure out what was wrong with me, I came here, and the first day at Bonati, it took like a few hours to get a diagnosis that I didn't have at home.
The exclusive Bonati spine procedures are performed on an outpatient basis, utilizing conscious IV sedation, where the patient remains awake and communicating with their surgeon to pinpoint their source of pain and eliminate it before they leave the operating table.
My first surgery was the left side L4, L5. I had a bulging disc in both levels that I had surgery on. I was awake during it.
No pain here?
No pain there.
No pain here?
No pain there.
Nothing here?
No.
All right.
After a brief stay in the recovery room, patients are asked to walk, and then they're free to head home or to a nearby hotel to continue with walking therapy and have a follow-up appointment scheduled the next day.
It's kind of weird. I mean, I've never had any other types of surgery or surgery on my back, surgery in general, but I know people don't just get up and walk out during surgery usually, so it was kind of weird. Like, I felt like the process was kind of fast forwarded, and I could get in the car and ride home, and after I walked, which wasn't long, just walk on the other side of the room and then put my clothes on and head out. After surgery, they told me that walk 40 minutes a day, and if you can't do it all at once, do it in increments, because walking is the best physical therapy, is pretty much what she said word for word. But, and then, ice, rest, walk. I didn't hear anything about back braces or anything like that. I would definitely recommend Bonati to anybody I know that has back pain. It was all in 4 days. I got a diagnosis and the surgeries, and I can already tell, like, I'm recovering pretty well. I can get up better already. When I get home, I'm looking forward to seeing my dogs, laying on the floor with them, hugging them. I like throwing toys for them, little tug-of-wars. I'm looking forward to being able to do just everyday tasks without thinking about my back pain.
To see more stories of recovery just like this, search for the Bonati Spine Institute on YouTube, Rumble, Apple's App Store, Google's Play Store, Roku, and Amazon's Fire TV.